Hey there, I'm back with another video, and this time it's going to be fatigue. And fatigue is one of the most important cases we can have on our Step 2 CS exam. And there is a lot of differential diagnosis, and it can also be a long case. I have taken this thing in a little detail and I've changed the pattern because to save time. So let's begin. So when I think about fatigue, this is my thought process. When I read there is a man with complaining of fatigue, so the differential diagnosis that I think about are these. So first one, it is psychiatry. That's the first one that I'm thinking about. Then endocrine. Then I'm thinking about a thin and a fat patient. And after that, this is my usual thought process: infection, inflammation, autoimmune, and of course this malignancy, which is very important. Malignancy. And in this we have colon cancer. This is a very important cause of fatigue. All right, so fatigue, differential diagnosis. First, psychiatric causes, endocrine causes, thin patient and obese patient, and then the fourth one is infection, inflammation, autoimmune, and malignancy. So under psychiatry, we are seeing, this is the mnemonic ACDS. ACDS. This is the mnemonic. And after ACDS, then A, acute stress disorder or post-traumatic stress disorder. And post-traumatic stress disorder is very important. It can cause fatigue. And then we have adjustment disorder or generalized anxiety disorder. This is very important. And with C, you have chronic fatigue syndrome. And with D, we have depression and domestic violence. And then S is for like sleep. That's what S stands for. Sleep changes, so narcolepsy and substance abuse. Then when we come to endocrine, we have hypothyroidism. Just like we have ACDS over here, I've just put HCDS. So hypothyroidism, hypercalcemia, diabetes mellitus and Sheehan syndrome. Diabetes mellitus and Sheehan syndrome. And next we have a thin patient to imply anemia, and a obese patient for obstructive sleep apnea. There is also, or you can even remember it as A and S over here. So S is again sleep, obstructive sleep apnea, and S is for shift changes at work. Next, we have infections. We have to ask for TB, HIV, and infectious mononucleosis. For TB, we have to ask, have you ever done a PPD? Have you ever got a PPD before? Or have you ever gotten exposed to someone with TB? Do you have night sweats? That's the questions we have to ask about. So we are going to think about this when the patient says he's come with the complaints of fatigue plus fever. Or then we think about for pancreatitis, fatigue, and abdominal pain, or diarrhea, loose stools, nausea, vomiting, alcoholic patient. That's how we think. For anemic patient, we have to ask, especially if it's a female, menstrual history. That is very important. And the only pertinent positive which we can get over here is heavy flow. This is the only pertinent positive we can get here, nothing else. Endocrine, for diabetes mellitus, we ask about polyuria, polydipsia. We know this. And then psychiatry. Everything, all these from endocrine 2 to 4, this can be covered in the mnemonic THENFRPUBS. Okay, this is the review of symptoms mnemonic that is over here, but this one we need a special mnemonic for this, which I'm going to cover. All right, now let's move to what are the questions that we are going to ask the patient. So as you can see, onset, frequency, duration, progression, and previous symptoms. So can you tell me more about your fatigue? How did it start? Do you feel like this every day? Is it constant? Or this is to mean, is it constant? Or do you have days in which you feel better? So do you have better days? Progression is it worse at the end of the day? And this implies myasthenia gravis, and this is the most important question perhaps Because if the answer is yes, then we have to ask about double vision, which can imply myasthenia gravis. We can even ask if you are having difficulty or pain during you have difficulty in swallowing or chewing. Do you feel tired? In those things. Then we have aggravating and relieving factors and associated symptoms. Now, before we go to associated symptoms, I want to talk about L. Like for pain, we do the OFDPP and LICRA questions. So I have taken the L from here and asked, does this fatigue affect your life or your job or performance? And does it affect libido? So we can use this L to remember, does it affect your life or libido, which is a very important, it is a pertinent positive question that we have to ask. It can be positive. All right. And now to remember the psychiatric symptoms, I have used the mnemonic S. So first is sleep. We have to ask detailed sleep questions over here. So how have you been sleeping? Are there changes in sleep pattern recently? Are there any changes in your sleep pattern recently? And then we ask about sleep hygiene, which means at what time do you go to sleep, and do you usually wake up early in the morning and stuff like that. Then we ask about snoring, choking and gasping. That can imply OSA. And then we have to ask about nightmares in case the patient gives us the history that anything major has happened in your life. When the patient is talking about fatigue or if he's depressed, anything, then he can have nightmares. So we ask about nightmares. In generally, SPs will give us any positive, pertinent positive when we ask about sleep. So if they don't, then we have to ask about nightmares. And then do you have any early morning awakening, which can be seen in depression. So first S is over. So then we have stress. The second S I have taken it for stress. So that can be the second S is for stress. Did anything major happen in your life, or has there any major change in your life a few months ago? This we are asking for PTSD. And then overexertion, is it affecting your job or performance or life? The same question we can ask it over here because it's very important. Next, do you have any shift changes at work? If there are any shift changes at work and the patient is complaining of fatigue and sleepiness, this can be the diagnosis, the first diagnosis. That's why we ask about it. If the patient gives the history of sleep. Then I have D and E. Okay, depression and emotional problems. We ask the patient, do you have any emotional problems along with depression? So for depression, we ask side caps, and this is a quick review: sleep changes, anhedonia, guilty, loss of energy, concentration problems. We have appetite changes, psychomotor changes, and a suicidal ideation. And I have added another S over here, support system. When we suspect a patient with fatigue is having any mood changes, we ask the patient, do you have any support system? Whom do you rely on for support? Do you have friends or family you can talk to? When we are suspecting a patient of fatigue with mood changes. Then the sort def, the mnemonic that we use frequently, this one, we have to ask it over here because we may run out of time and these are the pertinent questions. So ask it before. Sleep, we have covered. The patient has come with fatigue, so this is what is remaining. So any appetite or weight changes, which can imply cancer, and if the patient is overweight or has put on weight recently, it can be obstructive sleep apnea. And then diet and exercise. Next, social history, which is very important. We have to ask about alcohol, smoking, drugs, and coffee. Drugs is important over here if we are suspecting HIV. HIV can present as cough, it can present as sore throat, it can present as fever with weight loss, or it can present with fatigue with weight loss. Therefore, and if there is fatigue along with fever and there are no other symptoms other than the patient exhibiting risky sexual behavior and he does IV drugs, then it can also be hepatitis. So social history is very important. And then in sexual history, we inquire for decreased libido. So has this tiredness affected your relation, which is also covered in the question over here, L, in the beginning. All right, and then review of symptoms. The special review of symptoms that we are going to talk about over here is double vision. Like I said, we ask this question during the P of progression, and if the patient says I feel tired more during the evening, then we have to ask for double vision. And next we think about thyroid. We think about thyroid. This is swelling. We are thinking about thyroid. Then with T, we also think about thirst. This is for diabetes. So when you think about swelling, we also think about cold intolerance, hair, skin changes, especially if it's a female. It can be hypothyroidism. And then we ask for lymph adenopathy. In case you're wondering, these are the lymph nodes. Then we go on to ask fever, rash, night sweat, chills and rigors, cough, SOB, sore throat, chest pain, etc., etc., etc. If you don't want to remember this whole list, this is the mnemonic that we had in the video, general mnemonics, THENFRCSPUB. All these over here are covered in this mnemonic. So that's it for fatigue, guys. It is a very important case. We have to remember the differential diagnosis before going inside, and once we remember the differential diagnosis, we can remember the questions very easily. Just for the psychiatry part, I think we can remember the SS. Review of symptoms, we already have the mnemonic, which is THENFRPUBCS. But here we have to ask about sleep, which is going to be in the mnemonic SODEF, okay? Then, but we have to ask detailed questions about sleep, stress, shift changes, and in social history, please ask coffee and drugs for a fatigued patient. That's it. I hope you enjoyed this video and good luck with your exams.